So majority of the people that see me are women that have had children, and they get to that sort of stage where they've worked really hard to get back to their sort of post-baby bodies, and they just can't shift any more fat, or they've got all this extra loose skin, and so they come to me really quite self-conscious about how they feel, and you know, they'll get comments at the gym, you know, don't do that because you're pregnant when they're not, or they'll be exercising. I had a lovely lady that was a CrossFit trainer, and she just said when she lies forward, all her skin falls forward. So a lot of these women have done everything they can to make themselves as fit as possible, but there's just that little bit extra that they're having trouble with. So majority of the work I do is breast and tummy work. And I do a small amount of labia work as well. So, but that's for a specific area where they're mostly a functional issue with the labia. So, and with the breasts, it varies from a simple breast augmentation to a breast lift, and a breast augmentation, or using a combination of lift, augmentation, or fat to give the best possible result. So, yes. And then when it comes to tummies, with abdominoplasties, it's really important that women know that it's not really an aesthetic operation, it's a functional operation. So with abdominal surgery, what we basically do is it's not just removing that skin and fat, but it's repairing those internal muscles which have stretched over time, whether it's been from weight gain or from children, that haven't come back together, and giving you an internal strength and support, like an internal corset. And that actually helps with posture, it helps with back issues, it helps with stress incontinence, and women find that it not only makes them feel better because they can fit the clothes they used to fit, but also they can actually look after the children or do the activities that they used to be able to do before they had an operation, before they had children. Yeah. Well, I think we do approach things a little bit differently. It's a very warm environment, and specific women request women's surgery for religious reasons as well. So what I try to do is accommodate that not only in the rooms but in theatre. So I have all female staff specifically for those cases. So female anaesthetist, female assistant, female nurse, female technician, to basically make that environment as comfortable as possible. So for one, for religious reasons. For two, it is a different approach. I find it's a sort of a warm environment where any question is, no question is a silly question. I do as many consultations as required before that patient goes to surgery to make sure that they're really ready for the procedure and they're happy to proceed, which is different from some consultations where it's sort of a one consultation and then you book for surgery. So it's really how I'd like to be treated. And so in the end, I base my consultations and my procedures and my post-operative care on the experience I would like.